All right. We have our presentation on J. Sims Marion, the gynecologist surgical experimentation, presented by Dalen Johnson, Jadarius Simpson, John Simpson, Thomas York, and Marion Cassiano. In our introduction, a little background of Jay Sims. He was born January 25th, 1813, in Lancaster County, South Carolina, as well as began his medical practice. He attended South Carolina College, now known as University of South Carolina. He earned his medical degree from Philadelphia's Jefferson Medical College in 1835. He then relocated to Montgomery, Alabama after the death of his first two patients. He practiced medicine in central Alabama from 1835 to 1849. He was very well known as the father of gynecology. His practice was deeply rooted in the slave trade, and he built an 8-person hospital in the heart of the trading district here in Montgomery. He developed tools and surgical techniques related to women's productive health. He also pioneered techniques to repair the vesticovaginal bastula. Has to do with the complications of constant pain and urine leakage due to tears between the bladder and the uterus, often after labor or giving birth, as well as he invented the vaginal speculum, and that is used for dilation and examination of women.
So Dr. Sims used about a dozen enslaved women to conduct his experiments, many of whom were anonymous except for three. Betsy, there was Lucy, who almost died due to having a sponge left inside of her, and then there was Anarcha, who endured more than 30 surgeries before she was actually cured, and she was probably Dr. Sims' biggest success story. Um, and these women were vulnerable to this experiment and this experimentation because they were enslaved, so they could not give their own consent. They were desperate for cures for their conditions, and they saying no to these experimentations could be life threatening to them for various reasons, including the fact that they were enslaved women, but they were also desperate for a cure because they needed to not have this problem anymore so that they could actually give birth and so that they didn't have these consistent problems with urination and giving birth. Uh, they were also never given anesthesia because the belief at the time was that black people, especially black women, could not feel pain. So they were never administered anesthesia. And later on in the experiment, they actually had to perform some of the treatments alongside the doctor.
So Simmons came across an ethical violation when he returned to the women's hospital. He performed surgical treatment for women with cancer. At this time, they said cancer was a disruptive disease. The ladies on board decided to argue against Simmons' treatment to his patients. Society's response to what was done about it. When Simmons began experimenting on enslaved black women, he decided to use, or he didn't use any form of morphine or painkillers, which was the biggest problem for many people. Also, there were no form of written consent to any of his patients for these reasons, and some of which weren't. Or this was another big society did not like was the statue that was planted in New York. Was taken down recently though. Current ethical rules that exist now. So informed consent. It has to be get. You either have to get informed consent or implied consent. And informed consent is when the doctors have gone over risks of the procedure as well as alternative procedures and have explained in detail to what's going to happen to the patient. Implied consent is when a patient comes in without a guardian or it comes in unconscious, and doctors are implied that they can do surgery that will save the patient's life. The Patient Bill of Rights is given to any person admitted to healthcare associates, and it just states that they have the right to know what is being done, any medication or anything of that nature. And then the IRB is just a board of usually professors in scientific fields, and they are tasked with going over any type of experiment brought to them, and they have to consider if it's ethical or not.
So about the interesting facts about Sims. First of all, I forgot to tell, I'm from Brazil, so probably I'm gonna say some words wrong. But um, anyways, about him, he's the first man that creates a hospital for humans. That's kind of good, but other hand, it's not that good because he just made this because of the using black women, slaves, to create like mm, things for medicine. So um, one of the slaves mm, that he used to do these experiments. Her name that was Lucy, and she was his first patient. So he report in his book that she feels like so much pain, like no, really, like it's normal, because he didn't use I don't know how to say this in English, like the thing that you put to not feel pain. So and he say she feels so much pain and stuff like that. He thought that she's gonna die, but she didn't. And he used two more black women to finish his experiment, but I didn't find their names, but I didn't put it. So I didn't put it. And about him, he used to have like a statue in New York, but the people find out that he used black women and he make them suffer just to do experiments with them. And so the government take off his tattoo and put it where he's her body is right now. His body is right now. And a lot of people think he's the father of gynecologists, but for me personally, I don't think so because he made a lot of people suffer without like their concerns. He just asked the people from farm, like they have the slaves, and asked him, "Can I use her to do my experiment?" So he made a lot of people serve. At least he made good things because we as a woman right now we have a treatment for a lot of disease because of him. But on other hand, him, like I told before, he made a lot of people suffer. But I think like he made a good job trying to help women with this kind of disease like cancer. And he say her family today said he was not racist or something like that. Word for me, it's kind of not funny but interesting. And I think that's it.
All right. And this is our works cited page for our resources that we use to acquire our information. Thank you for watching our presentation.